Doctor, what is this intermittent fasting?
Intermittent fasting is popular nowadays. Many people are very enthusiastic and curious to know what it is. It's an eating pattern where you fast and eat alternatively. It means your fasting and eating windows are fixed. Three types are there in it. Number one is alternate day fasting, and the second being the 5:2. That is 5 days you eat per week and 2 days you fast. And the most popular and the most commonly practiced nowadays is 16:8. That is, you fast for 16 hours and you eat for 8 hours. That is, 16 hours is the fasting window and 8 hours is the eating window. For example, if you start eating at 12 o'clock, you can continue your eating window till 8 o'clock, and you have to give your the remaining 16 hours for the fasting. So that is the fasting and eating window commonly being practiced 16:8.
So, what are the benefits of it, Doctor?
So it has shown very good benefits in, and it mainly helps you for the fat loss and weight loss, and it is given a very promising results in obesity, controlling your overweight, and it is studies are showing that it also helps in reducing the blood pressure, cholesterol level, and it is in non-alcoholic fatty liver disease, and there are many benefits because it improves your overall metabolism.
Is it safe for everyone? If not, who should avoid it, Doctor?
See, the studies are showing that it is safer when you practice it for a short time, that is 3 to 6 months or till 1 year, and all healthy adults can practice this intermittent fasting.
Is there any age criteria?
There are few contraindications or few limitations for this intermittent fasting. There are few guidelines like children below 12 years of age, pregnant ladies, breastfeeding or lactation, or people with chronic health conditions like heart disease or liver disease, and elderly people, that is age more than 70 years, and people who are normal weight or normal BMI, or people with some eating disorders like psychological eating disorders. This intermittent fasting is being limited, like they are not supposed to do the intermittent fasting.
Is there any side effects, Doctor, by doing intermittent fasting?
Yeah, there are few side effects like commonly they face like headache, vomiting sensation, diarrhea, that is loose stools, dizziness, they feel dizzy, and they feel very tired, and they feel very fatigued. These are like very few complaints, but studies are showing that there are no major side effects when you practice it under guidance.
So, if I start doing intermittent fasting, so how can I can manage that hunger cravings?
See, this is a very interesting and very important thing, like how to control your cravings, or how to control your hunger when you are in the fasting period. Usually, when your stomach is full, you will not have that hunger signals. If you keep your stomach full, not have that hunger signals, and you will not feel hungry. A few tips for this is, you can have a black coffee or black tea, or if you add a teaspoon of ghee or coconut oil to the coffee, or if you add a teaspoon of olive oil to your olive oil or any oil to your meal, it, because of the high fatty content, it keeps your stomach full and you will not feel that hunger signals. So it helps you to keep under fasting for long hours.
So, would you recommend intermittent fasting?
So I do recommend intermittent fasting for weight loss, but it has to be done under guidance of nutritionist or any physician or any expert. So try to take the opinion before doing the intermittent fasting.
How this fasting helps in weight loss?
The principle of intermittent fasting being, when you are on fast for more than 12 hours, your body will respond to that fasting state, and it will release few hormones like insulin or cortisol and other hormones, which will burn. Energy comes from the stored fat, where your triglycerides or fat will be burnt and will be converted into energy. So that burned fat will help you for the weight loss.
Thank you, Doctor.